Welcome to Planetary Health First, Mars Next. This is an amazing day. We are live at VIVE, and we have Jenn Kerfoot, Chief Strategy Officer at DUOS, and man, we are doing some serious work here at VIVE, working it out. So glad you're here.
Thank you so much for having me. It's so nice and serendipitous that I'd bump into you in that big, massive cafeteria. So thanks for having me on.
Yeah, thanks for saying yes, and thanks for making this happen.
Absolutely. Congratulations on your first inaugural year at VIVE. It's a little bit hectic, a little bit crazy, but you're just doing such great work. I'm so happy that I could swing by.
Yeah, no, this is great, and it was awesome to have your teammate, Carl's, who's leading the Charles earlier today.
Oh, yeah, Carl's an absolute powerhouse, and I think just watching him work and meet people and network and see people he's known throughout his career at VIVE is just a masterclass in just networking, but also just building really meaningful connections throughout your professional career.
So I know we were talking a little bit, outside of the studio, but what we're here in the studio. So what do you want to drive today on the discussion if you could beacon out to the universe?
If I could beacon out to the universe. One of the most exciting things that I've seen here at VIVE is this discussion around value-based care. I know that at HLTH back in October, there was a really great panel between two just incredible minds discussing, have we reached the peak, the tipping point, if you would, of value-based care? Is it that we scrap it all and we need to go back to fee-for-service? What does that look like? And one of the things that I'm excited about is, looking forward towards 2025, although there's a lot of headwinds and, various forcing functions, especially going into an election year. It's looking how collaborative a lot of different, payers, partners, to payers, vendors, entities like DUOS, but also providers are looking at how can we double down on collaboration and better utilizing resources that we have to, be able to navigate the seas of unknown. So I'd had a handful of conversations in the last couple days around the Inflation Reduction Act. There is so much unknown out there, and historically, sometimes in healthcare, you see people that are, I'm going to stick with my department. I'm going to stick with, my team. But I see so much, interdepartmental collaboration going on in various components of the healthcare sector. I see a lot of, Best Buy is here, Samsung is here as well. Entities that we've historically seen, in ad pages that are now entering the healthcare conversation. It's really making me excited about, innovation. And I think that, during times of change is where we see a lot of really spectacular innovation come from. And so that's one of the things that's really energizing me while I'm here at VIVE this week.
Well, man, I'm glad you just kind of unpacked some really cool opportunities. Any details that you'd like to dive deep in any of those companies or organizations?
Yeah, absolutely. I think that there was a great Food is Medicine panel that showcased Instacart, Nourished and then US Hunger. US Hunger is a great nonprofit. They're one of our community champions for Connections for a Cause that we have at DUOS. But they're talking about how, Instacart is doing the fulfillment, US Hunger is doing the data analytics, Nourished is connecting all of that data and all of those pieces of information and contracting with payers together. It's just incredible collaboration. And then, as a good example, Humana has a partnership with USAA, and DUOS, we're working with Humana and a host of other payers to really address the far upstream barriers to healthcare. One of the things that I've said throughout my entire career is that, there are no gaps in care, there are barriers to care. And to really solve for what payers really need in terms of, continuing to be able to hit their street numbers and be profitable and keep a solvent health plan, it's incumbent upon all of us to really go way upstream and look at what is the root cause of barriers to access to care. I rebuke people who say people wake up in the morning and just go, it sounds good, just not taking care of my health. People want to engage in their health. There's a reason why they're not. It's either that we're not speaking in a way that's culturally and linguistically appropriate. It's that we aren't offering benefits that resonate with the population or that they can access it. There's so many different benefits that I see where members want to be able to access their healthy foods card, but they don't have a Walmart. I work previously with individuals on the Navajo Nation, and there's no Walmart around them. And that's what their flex card is for, to get groceries. And because they don't have a Walmart, they can't access the benefit. It's not tangible. It's not something they can touch and reach out and grab. And so I think it's what's really exciting about the work that we're doing at DUOS is that we make what an individual has within that sea of goodwill at their fingertips, either from their health plan, state, federal benefits, or community-based partners. We make that understandable, that component of health literacy where it's culturally and linguistically appropriate, and then make it accessible. You know, being able to reach out, touch it, have it actually be what we say at DUOS, the thing. You know, it's not this smoke and mirrors. It's actually something they can reach out and grab. Then making sure that it's actionable. It's not just a 1-800 number or a URL slug. It's something that they can really understand and take that last mile, and then making it measurable, because we're all good stewards of the taxpayers' dollars, in making sure that we're measuring, does this supplemental benefit have that reasonable expectation of improving health outcomes? CMS just issued a brief and guidance on February 21st about tracking supplemental benefit utilization, and also making sure we're collecting the correct pieces of information. And it's going to take all of us, payers, partners, and providers, working together to share that data.
Jenn, I feel like you just dropped a manifesto. But anyway, with Planetary Health First, Mars Next, we have this new initiative, Reimagine Healthcare Together.
Okay.
Bring a friend. And I would love for you to beacon out that person, that individual, to talk some more about that.
Yeah. You know, I have been so incredibly lucky in my career. And I say that the only word that I can use to describe it is lucky, because when I entered healthcare, you know, I didn't know the things that I know right now. I needed people to help me and teach me and guide me. And one of the individuals that was so critical to my healthcare journey and where I'm at today is Dave Meyer, former head of risk adjustment at Cigna. He's been at multiple successful organizations and really deeply understands not only data and analytics, but the flow of how, you know, money and risk adjustment work throughout a health plan. And so if I had to, you know, beacon out to a friend, I would say Dave Meyer. He's probably one of the most brilliant minds in healthcare, but I think he also is just, he just really understands working with people. And he understands not only the work that we do today that matters, he is looking towards the future and what we're going to be needing to do to lay those pavers, lay that foundation so we can build that house that lasts and can weather any kind of storm. So
Wow.
I'd say Dave Meyer, hands down.
Wow, you just knocked that out of orbit to Mars. That's awesome. Well, thank you so much for coming on today, Jenn.
Thank you so much for having me, Michael. All right.